Obesity is more than an issue of excess weight. It is a state of chronic physiological disruption. Beneath the surface of visible fat gain, a dangerous internal environment takes shape, one marked by systemic inflammation and profound hormonal imbalances. Together, these two forces converge into a perfect biological storm, creating conditions that are not only favorable but actively supportive of cancer development and progression. Chronic low-grade inflammation is one of the defining features of obesity. As adipose tissue expands, especially visceral fat around the organs, it triggers a cascade of immune responses that don't resolve. Fat cells, or adipocytes, enlarge beyond their oxygen and nutrient supply, leading to cellular stress and dysfunction. In turn, these stressed fat cells release inflammatory mediators such as tumor necrosis factor alpha, TNFA, interleukin-6, IL-6, and monocyte chemoattractant protein, 1, MCP-1, all of which recruit immune cells into the tissue. Macrophages infiltrate the fat depots and begin producing even more inflammatory cytokines, creating a feedback loop of persistent, damaging inflammation. This inflammatory state has widespread consequences for cancer risk. Unlike the sharp, temporary inflammation that follows an infection or injury, the inflammation in obesity is diffuse, continuous, and toxic to DNA. It promotes oxidative stress, damages the integrity of cells, and interferes with normal tissue repair. Over time, the inflammatory signals activate key cancer-related pathways, such as NF-B and STAT3, which drive abnormal cell proliferation and inhibit apoptosis, the body's natural mechanism for killing damaged cells. Inflammation also fosters angiogenesis, the formation of new blood vessels, which tumors require to grow and spread. At the same time, obesity distorts the body's hormonal environment, further amplifying cancer risk. One of the most critical hormonal changes is the excess production of estrogen in fat tissue. After menopause, when the ovaries stop producing estrogen, adipose tissue becomes the primary site of estrogen synthesis through the aromatization of androgens. In obese individuals, the increased fat mass leads to higher circulating estrogen levels, which directly fuel the growth of hormone-sensitive cancers, especially breast and endometrial cancers. Estrogen promotes the proliferation of epithelial cells in the breast and endometrium. With each cycle of cell division comes a risk of genetic error. In an environment already damaged by inflammation and oxidative stress, the likelihood of mutations increases dramatically. Estrogen also interferes with tumor suppressor genes and promotes the expression of pro-survival and anti-apoptotic proteins, tipping the balance further toward malignancy. Another key hormonal axis disrupted by obesity involves insulin and insulin-like growth factor 1, IGF-1. Obesity often leads to insulin resistance, which causes the pancreas to produce more insulin in an effort to regulate blood sugar. High insulin levels, along with elevated IGF-1, stimulate cell growth and prevent programmed cell death. Many cancer cells express insulin and IGF-1 receptors, allowing them to exploit this hormone-rich environment to grow more aggressively and evade immune detection. Leptin, a hormone produced by fat cells to regulate appetite, also plays a role. In obesity, leptin levels are chronically elevated, but the body becomes resistant to its appetite-suppressing effects. Instead, leptin acts as a pro-inflammatory cytokine and promotes angiogenesis, cell proliferation, and migration, all hallmarks of cancer. Conversely, adiponectin, another hormone secreted by fat tissue, is protective and anti-inflammatory, but its levels fall as obesity increases. This imbalance of leptin and adiponectin further shifts the internal environment toward one that favors tumor initiation and growth. Meanwhile, the immune system becomes compromised. Chronic inflammation and hormonal overload impair the function of T cells and natural killer cells, which are essential for detecting and destroying precancerous and cancerous cells. Obesity creates what some researchers now call an immune-permissive state, one where the immune system is too distracted or exhausted to effectively suppress early tumors. As tumors take hold, they are supported by the very same conditions that obesity has set in motion. Inflammation promotes angiogenesis, estrogen drives proliferation, insulin and IGF-1 enhance growth, and the immune system is too weakened to respond. This is not just a coincidence. It is a coordinated biological environment that supports cancer at every stage, from initiation to metastasis. What makes this reality even more concerning is how poorly it is understood by the public and even by many health professionals. Obesity is still most commonly associated with cardiovascular and metabolic disease, but its role in cancer is equally potent and arguably more dangerous because it often goes unrecognized. While heart attacks may occur suddenly and dramatically, obesity-driven cancers develop slowly and invisibly, often undetected until they are advanced and harder to treat. This lack of awareness results in missed opportunities for prevention. Patients entering weight management programs are rarely told that their weight puts them at serious risk for cancer. Primary care providers often screen for blood pressure and blood sugar, but fail to discuss how weight gain can set the stage for hormone-fueled malignancies. Public health campaigns emphasize fruits, vegetables, and exercise, but rarely mention that maintaining a healthy weight could save your life not just from diabetes, but from deadly cancers as well. Obesity creates a malignant biology. It is not neutral body mass. It is an active state of inflammation, hormonal distortion, immune dysfunction, and tissue stress, all of which are key ingredients in the development and spread of cancer. Until we acknowledge this reality, we will continue to underplay one of the most modifiable and most deadly risk factors for cancer in the modern world. We must stop thinking of obesity as just a weight issue or even as just a metabolic disease. It is a cancer-enabling condition. And if we fail to treat it as such, we are not only neglecting prevention, we are allowing a perfect storm to form inside millions of bodies, with consequences that are as tragic as they are avoidable.